Let's face it, we all know someone who seems to be living in their own personal reality show. But before we slap on the armchair therapist hats, let's understand what's really going on. Unlike a bad case of the Mondays, these are inflexible patterns of thinking, feeling, and behaving that cause significant distress and problems in relationships, work, and other areas of life. Personality disorders are grouped into clusters. First up, we have Cluster A, also known as the oddballs with occasional charm crew. These folks tend to be a bit eccentric and have difficulty forming close relationships. Here's the lowdown on the main characters in this cluster. Paranoid personality disorder. Ever feel like the pigeons on your windowsill are plotting world domination? No? Well, that's probably a good thing. People with paranoid personality disorder see hidden threats everywhere, believing others are out to get them or conspire against them. They're suspicious, distrustful, and always on guard, making friendships a real challenge. They might misinterpret harmless comments as hidden insults and hold grudges for years. Imagine living life like a spy movie, constantly deciphering coded messages from your grocery list. Causes. It's a mystery. Genetics and childhood experiences of abuse or neglect might play a role, along with possible brain abnormalities. Symptoms? Watch out for constant questioning of others' motives, a tendency to be easily angered, and difficulty relaxing due to the perceived threats lurking around every corner. Treatment? Think CBT, cognitive behavioral therapy, to challenge those suspicious thoughts and build trust in others, one step at a time. Imagine slowly turning down the dial on their internal suspicion meter. Schizoid personality disorder. Remember that viral meme about social interaction being a social construct? That's practically the life motto of someone with schizoid personality disorder. They have little interest in social activities and prefer the quiet solitude of their own company. They might seem emotionally detached and cold, but it's more about a deep need for alone time than actual dislike for people. Think of a philosopher king chilling in a cozy cabin, pondering the meaning of life. Minus the fancy robes and philosophical ponderings, of course. Causes are still being unraveled, but genetics and early childhood experiences might be contributing factors. Symptoms include a lack of interest in social activities, a preference for solitude, and a restricted range of emotions. Imagine someone who speaks in a monotone voice and seems unfazed by most social interactions. Treatment focuses on building social skills and coping mechanisms for managing loneliness, often through therapy. Schizotypal personality disorder. This one's a huge blend where things get a little weird and wonderful. People with this disorder might have odd beliefs, unusual speech patterns, think rambling or overly metaphorical, and even experience fleeting perceptual experiences like seeing shadows or hearing strange sounds. They might also have difficulty forming close relationships and seem socially awkward. Imagine someone who believes in telepathy, speaks in riddles, and occasionally sees things others don't. Just think of it as a quirky mix of eccentricity and mild peculiarities, like believing your pet goldfish is judging you silently. Hey, we've all been there, right? Causes are a mix of genetics and brain development. Symptoms include magical thinking, social anxiety, and difficulty expressing emotions. Treatment often involves CBT to manage those odd beliefs and social skills training to help them connect with others, even if it's in their own unique way. Cluster B, also known as the party animals and the party poopers crew, is where things get interesting, for everyone else that is. These folks tend to be flamboyant, emotional, and have stormy relationships. Ready to meet some real characters? Let's start with Antisocial personality disorder. This is the one you see portrayed in movies. The ruthless con artists, the manipulative schemers. Terms like psychopath and sociopath are also used interchangeably to informally describe someone with ASPD, an interesting topic all by itself. People with antisocial personality disorder lack empathy and remorse, making them exploit others without a second thought. Think of a smooth-talking used car salesman, but for everything in life. They might be charming and charismatic on the surface, but underneath it all, there's a lack of concern for others' feelings or well-being. Causes are a complex mix of genetics, childhood environment, think neglect or abuse, and brain development. Symptoms include a lack of empathy, impulsivity, and a history of breaking rules and laws. Treatment? Unfortunately, there is no cure, but therapy can help manage their behavior and reduce the risk of harm to themselves or others. Think of it as setting boundaries and teaching them to consider the consequences of their actions. Borderline personality disorder. Imagine living on an emotional roller coaster with a side of whiplash. That's borderline personality disorder in a nutshell. People with this disorder experience intense, unstable emotions, impulsive behavior, and rocky relationships. They might have a fear of abandonment and engage in self-harm or suicidal threats. Picture someone who goes from anger to love in a heartbeat, struggles with self-control, and might lash out at loved ones due to intense emotions. It's enough to make anyone dizzy. Causes are likely a combination of genetics, childhood trauma, and brain development. Symptoms include unstable moods, unstable relationships, impulsive behaviors, and self-harm. Treatment? Think dialectical behavioral therapy, DBT, to manage emotions, improve communication skills, and build healthy relationships. Imagine learning coping mechanisms to ride the emotional waves instead of getting swept away by them. Histrionic personality disorder. The Drama Llama has officially entered the chat. People with histrionic personality disorder crave attention and will do whatever it takes to be the center of it all. They're often overly theatrical, flamboyant, and might even resort to manipulation to get their way. Picture the friend who throws a tantrum because their outfit isn't Instagram-worthy, but on steroids. Causes are likely a combination of genetics, childhood environment, think a lack of attention, and a desire for validation. Symptoms include excessive need for attention, overly dramatic behavior, and difficulty maintaining stable relationships. Treatment? Therapy to manage their need for attention and develop healthier ways to connect with others. Narcissistic personality disorder. The self-absorbed superstars of Cluster B. The name itself conjures up images of self-importance so inflated it could launch a hot air balloon. People with narcissistic personality disorder have an unshakable belief in their own grandeur, a deep need for admiration, and a complete lack of empathy for others. They might exploit others, be arrogant, and have fragile egos that can't handle criticism. They believe they're superior and deserve special treatment, basically the human embodiment of an eye-roll emoji. Causes are likely a combination of genetics, childhood environment, think excessive praise or indulgence, and a need for admiration. Symptoms include an inflated sense of self-importance, a need for admiration, and a lack of empathy for others. Treatment? There's no cure, but therapy can help them develop empathy and improve their relationships. Just think of it as learning to see the world from other people's perspectives and build genuine connections. Cluster C, also known as the anxious bunch, but they're bunches of fun, maybe. These folks tend to be nervous, self-conscious, and have difficulty asserting themselves. Here's a look at the key players in this cluster. Avoidant personality disorder. Wallflowers unite. People with avoidant personality disorder have an intense fear of social disapproval and rejection. They have a pervasive fear of social situations, feeling inadequate and unappealing to others. They might avoid work, relationships, and any situation that involves social interaction. Picture someone who cancels plans last minute due to anxiety, avoids making eye contact, and constantly worries about being judged. Causes are likely a combination of genetics, childhood experiences of criticism or rejection, and a temperament that's naturally shyer. Symptoms include social anxiety, feelings of inadequacy, and a desire to be alone. Treatment: CBT and exposure therapy to help them manage their fear of rejection and develop social skills. Imagine gradually stepping outside their comfort zone and learning to navigate social situations with confidence. Dependent personality disorder. Neediness redefined. People with dependent personality disorder have an extreme fear of being alone and rely heavily on others for basic needs and decision-making. They might struggle to take initiative or be assertive for fear of upsetting someone. Imagine needing your partner to pick out your outfit every morning. Not because you lack fashion sense, but because the thought of making a decision is paralyzing. Causes are likely a combination of genetics, childhood experiences of neglect or abuse, and a temperament that craves security. Symptoms include a fear of being alone, difficulty making decisions, and a need to be taken care of. Treatment: therapy to help them develop self-confidence and build healthy, independent relationships, teaching them to trust themselves, make their own choices, and foster healthy attachments. Obsessive-Compulsive Personality Disorder, OCPD. We all know someone who likes things a certain way, but for people with OCPD, it's an obsession. They're preoccupied with orderliness, perfectionism, and control. Rules and routines are their best friends, and any deviation can cause major anxiety. Think of Monica Geller from Friends, but with a side of crippling anxiety and a judgmental stare for anyone who dares move her stapler. Causes are likely a combination of genetics, childhood experiences of strictness or criticism, and a temperament that craves control. Symptoms include a need for orderliness, perfectionism, and difficulty delegating tasks. Treatment: CBT to manage their need for control and help them become more flexible, learning to let go of the small stuff and embrace a bit of spontaneity. Here are 5 helpful tips when dealing with personality disorders. Number 1. Don't diagnose yourself or others from YouTube. These summaries are for informational purposes only. A qualified mental health professional can provide a proper diagnosis and treatment plan. Number 2. If you suspect a personality disorder, seek professional help. Early intervention can make a big difference in managing symptoms and improving quality of life. Number 3. People with personality disorders are still people. They deserve empathy, understanding, and support. Number 4. Educate yourself. The more you know about personality disorders, the better equipped you are to navigate relationships and support those who might be struggling. Number 5. Take care of yourself. Supporting someone with a personality disorder can be emotionally challenging. Make sure you prioritize your own well-being. There's no shame in seeking help, and with the right approach, you can manage these conditions and live a fulfilling life. Don't let your personality disorder define you. You are more than your diagnosis. These are some personality disorders explained.